Sabadi, you're now watching LNTV News program. I'm Noi Sang Surya. We firstly start with the local news. And more than 100 nurses from Laos and Japan attended a photo exhibition celebrating nursing activities to mark International Nurses Day at Sathatirat Hospital in Vientiane last Friday.
Laos, Japan celebrate International Nurses Day by organizing activities, which the event attended by Deputy Director of the Therapy Department of Sathatirat Hospital, Associate Professor Dr. Janpoma Wongsampan, and Japan International Cooperation Agencies, or JICA, Takashima Hiroki. International Nurses Day, which celebrates annually on May 12th, is the anniversary of the birth of Miss Florence Nightingale, who is renowned for laying the foundations of modern nursing services. Celebrating the day is important for nurses in Laos because it means they are part of the international nursing community. Through these events, Lao nurses promote awareness of the role of nurses. At the event, participants were told about the history of International Nurses Day and the regulations and guidelines on nursing practices. We're pleased to participate in this event today to raise awareness of the importance of nursing. Our slogan for this year's International Nurses Day is "Nurses leading and delivering quality primary health care for all." JICA has implemented a human resources development of nursing and midwifery project in Laos. The project is aimed to develop the nursing sector through the strengthening of education so as to be able to allocate sufficient numbers of qualified nurses and midwives to ensure the provision of better health services at all hospitals throughout the country. JICA organized events to celebrate International Nurses Day at Mahosot Hospital in 2006 and at Friendship Hospital in 2007.
And now time for a break, and we'll come back with more news.
Regulation booklets covering nursing and midwifery have been supplying to healthcare facilities around the country in an effort to improve services. From now, officials and staff in hospitals and schools around the country are expected to continue disseminating these regulations and guidelines and monitor their applications. The Project for Human Resource Development of Nursing and Midwifery, which is supported by the Japan International Cooperation Agency, or JICA, presented booklets containing 1,000 copies of guidelines on the scope of nursing practices and 100 copies of nursing and midwifery school management and implementation to the ministry yesterday. The regulations were signed by the Minister of Health, Dr. Bonmek Dalaloy, on June 20, 2007, as part of a project agreement. Regulation booklets provided in order to promote the new regulations and guidelines to people working in healthcare facilities. The nursing and midwifery sector plays an important role in healthcare services in Laos, but the quality of government administrations of the sector and of the nursing education is not adequate and substantial improvement is needed. We believe many nurses have already received information about the regulations and guidelines contained in the booklets. According to press release issued by project coordinators, at a central level, the ministry is the key body directing health administrations and implementing health policies and strategies. Under the ministry, each department independently promotes its designated services. But coordinations and collaborations among these departments is often inefficient. There are no established regulations for doctors, nurses, and midwives. Without regulations, the job descriptions and qualifications of these medical staff is not officially defined.
Sabadi and welcome to LNTV English News Program, broadcast from Vientiane on Channel 1. And we start firstly the local news. And 24 teachers and clinical practice instructors from Champasak province received training to upgrade their qualifications under a first fundamental nursing trainer course which organized to Ministry of Health or MOH and JICA Nurse Project.
The Japan International Cooperation Agency or JICA is funding the project to upgrade teachers and clinical practice instructor skills. According to the ministry's Organization and Personnel Department Director General Kampon Putavong, upgrading nurses' skills will contribute to human resources development in the health sector. He said the main objective of the project was to strengthen the experience of nurses and improve medical services throughout the country. He is also confident teachers will manage the project effectively. In the Lao PDR, health care services are mainly provided by nurses, midwives, but as the level of these services is not adequate, there is an urgent need to develop nurses, midwives with appropriate knowledge and skills and to improve the services. It is expected that by implementing above training in Champasak province, the project team and MOH expected that Champasak province will become a nursing mode province. The assistance from JICA is said was important for human resource development in Laos. JICA and the Japanese government have supported many projects contributing to the development of the country. Sabadi, welcome to LNTV English News Program for Thursday, December 25th. I'm Silimata Dongpumi. JICA Nurse Project aiming at intensifying governmental administration for nurses or midwives closed yesterday in Vientiane. Acknowledging the importance of midwives in improving mothers' and children's health, Lao Ministry of Public Health in collaboration with JICA organized a 10-day training course for 24 teachers of Champasak Health School and clinical practice instructors at Champasak Hospital. The 24 participants are divided into two groups. The training course for the first group was implemented from 24th of November to 3rd of December 2008, while the second group started from the 15th to 24th of December.
วิชาที่ว่าพวกเขามาอบรมในศูนย์อบรมในสุดนี้นะมี
Participants were taught first fundamental nursing knowledge and skills, including 19 titles, from accepting patients, making medical records, to infective prevention and treatment.
การพยาบาลการซักยาโบจังซี่ดีๆแล้วก็จนมาถึงเรื่องการติดเชื้อเนาะ
ผ่านการฝึกอบรมในครั้งนี้น้องสามารถเรียนรู้เกี่ยวกับการ
I've learned many useful skills, for example, antiseptics, infective prevention from patients to clinical staff, and vice versa. These are very fundamental knowledge that every healthcare providers need to know.
In addition, the team members also developed a textbook for fundamental nursing. This textbook is the first of its kind written in Lao and by nurses. After this training course, participants will provide training of fundamental nursing to staff nurses at Champasak Hospital from March 2009 by implementing this kind of training in Champasak province. The project team at the Ministry of Public Health expected that Champasak province will become a nursing model province, and the nurses of the province are able to wear crystal pearl mind of nursing care.